So we talked about the corticosteroids or glucocorticoids, which is probably the most common medication that's used to treat the lupus, especially if there's ongoing disease. But it's also used in a lot of other conditions such as asthma. And so in this case, there is some concern that using glucocorticoids or corticosteroids would increase the risk of cleft palate or cleft lip. So this is a proprietary database where they just looked at whether or not a woman had a prescription for any type of corticosteroid. It says nothing about dose. It says nothing about the indication for use. But you can see that any use and prednisone use was associated with an slight increased risk of cleft lip and cleft palate when it was used early. So as soon as a woman hears this, she's going to say, I'm not taking that, even though the risk is very, very small. And what you have to do is really individualize the conversation, and for the specific mom, you have to say that the literature suggests that there might be a slight risk of this malformation, especially when you take it early in pregnancy. I can't say anything about dose because that information was not available in the study, but then you have to balance this risk out by the potential benefit of taking the medication so the mother is healthy so that the baby is better, and if you harm the mom by taking away her medications, it may be that then that's bad for the baby too. And in most cases, and in our experience, the mother is much more likely to get sick if I take the medicine away. And it's very, very unlikely that the baby's going to have this congenital problem. But the woman's going to read about this, and you have to go through what's available and try to present a balanced case and help the woman and her partner decide about the medications. Sometimes you need to use those immunosuppressive drugs, and this is a study that was done that looked at pregnancy outcome based on whether or not these medications were used. So group 1 were women who never took an immunosuppressive drug during pregnancy, and in the second column, it shows that about half the time there was a problem with the pregnancy. Group 2 were the women who took an immunosuppressive drug at any time or during pregnancy, and you notice that they did better, that the chances of a bad outcome were less because we treated the underlying disease. So this reinforces what we also talked about in terms of the corticosteroids, that the overriding principle here is to control the mother's disease. That's the best outcome for baby, and to use the safest drugs that are available to do that. One of the most common drugs that's now being used to treat lupus and specifically kidney disease is mycophenolate mofetil or myfortic acid. And originally this medication and its cousin had an FDA safety category for pregnancy as C, which meant that it was unlikely to cause any problems in the baby. But this designation was changed to D as part of the post-marketing surveillance because this medication is also frequently used to maintain kidney transplants. And in monitoring this database, they found that there was an increased risk of spontaneous abortion in the first trimester, and also an increased risk of congenital malformations and a specific pattern of malformations, mostly involving the face, small face, cleft lip, cleft palate, and also problems with ear anomalies. So based on these observations, this medication is now changed to D, and we would choose other medications, and I listed the ones that were safe to use during pregnancy. Many of the women who have the kidney disease problem with lupus need to be on blood pressure medicines, and the one we usually choose is that ACE inhibitor that we talked about earlier. In this situation, this is one of the cases where we do have to switch the medications because there are major congenital malformations when a fetus is exposed to this medication during the first trimester. And this again looked at a large proprietary database, and infants who were exposed to this medication were at increased risk of malformations of the cardiovascular system and the central nervous system. So in almost all circumstances, we would recommend that you change this medication to something else that would still control blood pressure but not increase the risk of malformations. If the woman had elevated cholesterol or lipids, they may be on a statin, and there are case reports that suggest that this medication might be harmful to the baby. And in this case, there were 22 infants who were exposed during their first trimester in utero, and there were limb defects and central nervous system anomalies. This was not confirmed in a prospective observational study, but again, this would at least suggest that you think about whether or not it's absolutely necessary for this medication to be used during pregnancy. And these are some of the data of women who were exposed or whose infants or fetuses were exposed to this medication during pregnancy, and a group of women whose babies were not exposed, and they looked at birth defects, gestational age, birth weight, and if they had any problems after birth. And even though there's no difference between these two groups, most of the time there was an increase in the babies who were exposed to those medications in utero. So this would be the data that would at least make you think twice about whether or not you needed to take that medication, and might there be another substitute such as stricter diet control. Most of the women who have lupus are concerned about getting early osteoporosis, either from the disease itself or from the glucocorticoids. And these are some helpful things to think about in terms of managing bone health in a young woman who has lupus. So you'd want to do all of these things even before she's pregnant, and certainly reinforce them when she would become pregnant. So you would want to maximize lifestyle modifications by making sure the woman is taking adequate vitamin D and calcium. You want to make sure that she has quit smoking, that she's exercising, and that when you do use lupus medications that might have an adverse effect on the bone, you want to make sure that you've given her exactly what she needs for as long as she needs and try to minimize the exposure. There is a group of medications that are used to treat osteoporosis, and they're called bisphosphonates. They are teratogenic in animals, and this medication stays in your body for 10 years. And so if a woman is planning to get pregnant, you may decide not to use this medication and try to maximize all those other things in this list so that you would not have to even think about using this medication when you're pregnant. And lastly, I'd like to talk about medication use when lactating or breastfeeding. The list is going to be fairly similar to what was permissible during pregnancy, though there are some minor adjustments. You can still use the glucocorticoids or corticosteroids, again trying to use the lowest effective dose. You would discontinue non-steroidal anti-inflammatory drugs, but if the woman needed to be on low-dose aspirin, that would be satisfactory. You can continue the hydroxychloroquine and sulfasalazine, but you cannot use the azathioprine or cyclosporin, which was permitted during pregnancy. You would not want to have the woman on that medication if she chose to breastfeed. And also the mycophenolate mofetil, methotrexate, cyclophosphamide, and leflunomide are all contraindicated. The woman can go back on the oral form of the blood thinner medication. We had switched her from the warfarin to the injectable heparin formats. During pregnancy, they can go back to the Coumadin or the warfarin when they are breastfeeding. So now when you go back and look at this young woman and you're thinking about how you want to treat her, I hope that all of this information will help you put things in perspective as you go through this list of medications and the choices you have in terms of treating her disease and providing supportive therapy, and also trying to maintain as best as you can the opportunity for pregnancy in the future. Thank you.